Hey there, welcome back. Have you ever found yourself staring at your computer screen, completely forgetful of what you were working on? Or maybe you've had moments when you just can't seem to gather your thoughts, no matter how hard you try? If so, you're not alone. Many people experience brain fog, a term that describes that fuzzy, cloudy feeling in your head that makes it hard to think clearly. But what exactly causes brain fog, and how do mental health issues and medications play a role? Let's dive in. Brain fog isn't a medical diagnosis, but rather a collection of symptoms that can leave you feeling mentally sluggish. It can involve difficulty concentrating, forgetfulness, or a sense of confusion. People often describe it as feeling like they're in a haze. You might feel perfectly fine physically, but mentally, you're just not quite yourself. Brain fog can manifest in different ways, including memory issues, forgetting things easily, or struggling to recall names, dates, or facts. Difficulty concentrating, finding it challenging to focus on a single task, or easily getting distracted. Mental fatigue, feeling mentally exhausted even after normal tasks. Lack of motivation, struggling to initiate tasks or feeling disinterested in activities you usually enjoy. Understanding that brain fog is a symptom rather than a standalone condition can help you identify underlying issues more effectively. Mental health issues such as anxiety and depression are often major contributors to brain fog. When you're dealing with stress or emotional distress, your brain can become overloaded. Here's how. Anxiety. When you're anxious, your mind is busy racing with worry. This constant state of tension can make it tough to focus on tasks at hand. For instance, if you're constantly worrying about deadlines or personal relationships, your cognitive resources are drained, leading to fogginess. Depression. Similarly, depression can sap your motivation and concentration. It's like trying to think through a thick fog. Your mind feels heavy, making it hard to concentrate on anything, big or small. Those suffering from depression may find even simple tasks overwhelming. Stress. Chronic stress elevates cortisol levels in the body, which can negatively affect brain function, particularly areas associated with memory and decision-making. Over time, chronic stress can lead to lasting cognitive issues if not managed properly. If you're feeling like your mental health is affecting your clarity, reaching out to a professional can be a great step. Therapy, support groups, and other resources can help you manage anxiety or depression, reducing that pesky brain fog. Medications and brain fog? Sometimes medications intended to help with mental health can also contribute to cognitive fog. Here are a few things to consider. Antidepressants and anti-anxiety medications. Certain medications can cause side effects that include brain fog. While they may alleviate symptoms of anxiety or depression, the trade-off may be a bit of cognitive sluggishness. SSRIs, selective serotonin reuptake inhibitors, for example, often result in drowsiness or cognitive slowing. Antihistamines. Over-the-counter allergy medications may also lead to drowsiness or cognitive issues. If you're using these regularly, consider discussing alternatives with your healthcare provider. Other medications. Many prescriptions for various conditions, like high blood pressure or some pain medications, can impact cognitive function. For instance, benzodiazepines, used primarily for anxiety, can impair short-term memory. It's essential to keep an open dialogue with your healthcare provider about all the medications you're taking and their potential side effects. Other health-related causes of brain fog. While mental health and medications are significant contributors to brain fog, they are not the only players in this complex game. Here are other health-related causes that may lead to cognitive cloudiness. Sleep disorders. Sleep apnea, insomnia, and restless leg syndrome can significantly disrupt sleep patterns, preventing you from reaching the deep restorative sleep your brain needs. Poor sleep quality results in decreased cognitive function, leading to difficulties in concentration and memory recall. If you suspect you have a sleep disorder, seeking a professional evaluation can lead to improved sleep quality and cognitive clarity. Hormonal changes. Hormonal fluctuations can lead to brain fog. Women, in particular, may experience this during menstruation, pregnancy, or menopause due to changes in estrogen and progesterone that affect mood and cognitive function. If hormonal changes are contributing to brain fog, lifestyle adjustments or medical interventions may help ease symptoms. Thyroid issues, hypothyroidism, or an underactive thyroid can lead to lethargy, cognitive slowing, and brain fog due to insufficient thyroid hormones that impact energy levels and metabolic processes. If you're experiencing symptoms like fatigue, weight gain, or cold intolerance alongside brain fog, it's worth discussing with your healthcare provider to assess your thyroid function through blood tests. Proper management of thyroid levels can often alleviate cognitive issues. Chronic fatigue syndrome, CFS. CFS is a complex disorder characterized by extreme fatigue that doesn't improve with rest. Those suffering from CFS often report significant cognitive difficulties, often referred to as brain fog, which impacts their ability to think clearly or process information. While the exact cause of CFS remains unknown, treatment often focuses on managing symptoms and improving quality of life. Fibromyalgia. This condition is known for causing widespread pain, but is also linked to cognitive difficulties, often termed fibrofog. Those with fibromyalgia might struggle with memory, attention, and mental clarity, similar to brain fog resulting from other conditions. Gentle exercise, cognitive behavioral therapy, and medications aimed at managing pain and sleep can help mitigate these cognitive challenges. Nutritional deficiencies. Deficiencies in certain vitamins and minerals can lead to cognitive issues. Vitamin B12, for instance, is crucial for nerve function and cognitive health. A deficiency can result in memory problems, mood changes, and difficulty concentrating. Similarly, a lack of omega-3 fatty acids found in fish and flaxseed has been linked to cognitive decline. Ensuring a nutritionally balanced diet or taking supplements if necessary can help boost your mental clarity. Dehydration. Even mild dehydration can impair cognitive function. The brain is largely composed of water, and insufficient hydration can lead to decreased attention span and memory retention. Staying well hydrated is essential for optimal brain function, so make sure to drink enough fluids throughout the day, especially if you are active. Autoimmune conditions. Certain autoimmune disorders, like lupus, multiple sclerosis, and rheumatoid arthritis, can lead to inflammation that affects cognitive function. These conditions can cause a range of symptoms, including brain fog, fatigue, and cognitive impairment. Effective management of the underlying autoimmune condition is key to alleviating these cognitive symptoms. Chronic infections. Some chronic infections, such as Lyme disease or viral infections, may lead to prolonged fatigue and cognitive difficulties. The immune response to these infections can cause inflammation and other physiological changes that impact cognitive health. If you suspect a lingering infection, it's important to consult a healthcare professional for proper evaluation and treatment. Environmental toxins. Exposure to environmental toxins, including heavy metals like lead or mercury, and chemicals, can adversely affect brain function. These substances may lead to neurotoxicity, impacting memory and cognitive processes. If you suspect exposure, work towards reducing contact with these toxins and seek medical advice on testing and mitigation strategies. Brain fog can have significant implications for daily life, impacting both professional and personal domains. Work performance. Cognitive difficulties can reduce productivity, creativity, and decision-making abilities, leading to decreased performance at work. Tasks that require focus or detail-oriented work may become challenging, potentially affecting long-term career progression. Interpersonal relationships. Brain fog can hinder communication and social interaction. Forgetfulness, difficulty concentrating during conversations, or not being fully present can strain relationships and lead to misunderstandings. Mental well-being. The frustration from experiencing brain fog can further exacerbate feelings of anxiety or depression, creating a cycle that can be hard to break. Feeling mentally sluggish can lead to a lack of confidence in your abilities, which can further impact your mental health. Safety concerns. Cognitive impairment may increase the risk of accidents, such as forgetting tasks while driving or mismanaging medication. Being aware of your cognitive state and exercising caution when required is vital for safety. If you're struggling with brain fog, particularly connected to mental health or medications, here are steps you can take to alleviate symptoms. Seek help. A mental health professional can provide strategies and treatments tailored to your needs. Cognitive behavioral therapy, CBT, and other therapeutic interventions can be highly effective in addressing mental health concerns. Keep a medication journal. Track when you experience brain fog to help identify any patterns related to your medications. Discuss with your doctor any side effects and potential alternatives. Fine-tune lifestyle choices. Engagement in regular physical activity can help boost your mood and cognitive function. Aim for at least 150 minutes of moderate aerobic exercise per week, as this can stimulate brain health and enhance mental clarity. Practice mindfulness. Techniques like meditation and deep breathing exercises can help center your mind and reduce stress. Mindfulness practices are known to improve attention and cognitive function. Prioritize sleep. Make sure you're getting quality, restorative rest, as sleep is crucial for cognitive clarity. Establish a calming bedtime routine and prioritize good sleep hygiene by maintaining a consistent sleep schedule. Eat well. A balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can nourish your brain and help improve mental clarity. Foods rich in antioxidants, omega-3 fatty acids, vitamins, and minerals can support brain health. Consider incorporating fatty fish, rich in omega-3s, helping to improve cognitive function. Leafy greens, high in vitamins and minerals crucial for brain health. Berries, packed with antioxidants that can protect brain cells. Nuts and seeds, great sources of healthy fats and vitamins, supporting overall brain function. Stay hydrated. Ensure you're drinking enough water throughout the day. A general rule of thumb is to aim for at least 8 8-ounce glasses, but this may vary based on activity level, climate, and individual needs. Manage stress. Engage in activities that bring you joy and relaxation, whether it's exercise, hobbies, or spending time with loved ones. Regular relaxation techniques can help lower stress levels and improve focus. Consider a supplement. If you suspect nutritional deficiencies may be affecting your cognitive function, consider speaking with a healthcare provider about potential supplements, like vitamin B12 or omega-3 supplements, based on your specific needs. Monitor health conditions. Regular checkups with your healthcare provider can help manage any chronic health conditions, like thyroid issues or autoimmune disorders, that may contribute to brain fog. Maintaining open communication about your symptoms and treatment plans is essential. Limit alcohol and caffeine. While moderate caffeine can enhance alertness, excessive amounts can lead to anxiety and disrupt sleep patterns, further contributing to brain fog. Alcohol can have similar effects, impairing cognitive abilities and affecting sleep quality. Moderation is key. Engage your brain, stimulate your mind with puzzles, reading, or learning new skills. Engaging in intellectually stimulating activities can help strengthen brain function and improve cognitive clarity over time. Brain fog can be a frustrating experience that affects many aspects of life, from work performance to interpersonal relationships. Understanding the role that mental health, medications, and other health-related factors play in your cognitive clarity is essential for finding ways to cope and improve. Recognizing the underlying causes, whether they be nutritional deficiencies, sleep troubles, chronic health conditions, or hormonal changes, can help guide you toward effective solutions. If you feel like brain fog is taking over your life, consider consulting a healthcare provider for a comprehensive evaluation to identify potential causes and receive tailored advice. Remember, it's never too late to reach out for help and take proactive steps to nurture your mental and physical well-being. By implementing lifestyle changes, seeking professional support, and addressing any underlying health concerns, you can work toward clearer thinking and a more vibrant, fulfilling life. You've got this. Take charge of your health and well-being, and don't hesitate to explore treatments or strategies that resonate with you. Addressing brain fog not only improves cognitive clarity, but can also enhance overall quality of life, leading to better mental health, productivity, and joy in everyday activities. Thanks for watching as always, and be well.